Hello, and thank you for joining today's webinar, Safeguarding Access to Clean Drinking Water in Arizona, Uranium Mining and Health. My name is Kara Cook, and I'm the Climate and Health Program Manager for the Alliance of Nurses for Healthy Environments. This webinar is presented in partnership with the Alliance of Nurses for Healthy Environments and the Phoenix chapter of the National Association of Hispanic Nurses. On this webinar, speakers will highlight some of the biggest challenges impacting water supply in communities in Arizona, with a focus on uranium mining and health impacts. Speakers will also share examples of how nurses and other health professionals can get involved with advocating for critical access to clean and safe drinking water. Before I get started, I just have a few housekeeping items. We'll take questions at the end of the presentation. You can enter a question during or after the presentation by entering it into the chat box in the bottom left-hand corner of the screen. This webinar is being recorded, and the link will be sent out to those who registered. One nursing continuing education will be provided for today's webinar. In the follow-up email that will be sent out, you will receive a link to complete an evaluation and post-test. You must complete the evaluation and post-test to receive Nursing CE. With that, I'm thrilled to introduce our moderator for today. Paulette Rangel is a native of Arizona and has been a nurse for 8 years, with 6 of those years specializing in critical care. She currently works in the cardiothoracic ICU at St. Joe's Hospital and Medical Center in Phoenix. There, she serves as the chair of the ICU Practice Council and is a transport nurse on the only ECMO transport team in Arizona. She has been a member of the National Association of Hispanic Nurses for 10 years, where she has served in various roles on the board of directors throughout the years. And as of 2020, Paulette has stepped into her role as the president of the Phoenix chapter of NAN. So with that, I'll turn it over to you, Paulette.
Thank you so much, Kara. I really appreciate the Alliance of Nurses for Healthy Environments for having the National Association of Hispanic Nurses Phoenix chapter as a part of this. And we're really excited to hear about this topic, which, like I said, as a native of Arizona, we really don't have I didn't know about some of these issues that are going on in our own communities. And so I do want to tell you guys a little bit about the Hispanic nurses really quick before we get started. We are one of 2 chapters in Arizona, and we are the 3rd largest chapter in the United States. We have about 150 to 160 members. And our mission is, we're committed to advancing the health of the Hispanic community in Arizona. And we do that through advocacy, educational, professional, and leadership opportunities for Hispanic nurses. So I'm really honored to be moderating today, and we're going to go ahead and get started, and I will introduce the speakers. Dr. Carolyn Roman, she holds a bachelor's degree from Clark University and a PhD in neuroscience from the University of Vermont. For the past 3 years, she's been working at the University of New Mexico as a science research manager for the Community Environmental Health Program with Drs. Jonan Lewis and Deborah McKenzie. In this role, she manages logistics and supervises field staff for the Navajo birth cohort study and is the center administrator for the UNM's Metals Superfund Research Center. Most recently, she has co-organized a GoFundMe page, Navajo and Tribal Clinical Relief Support, which has raised funds to get PPE and basic need supplies out to Navajo and Zuni hospitals. Although she has lived all over the country, she is happy to now call New Mexico her home, where she lives in the Sandia Mountains outside of Albuquerque. Thank you, Dr. Roman, for being here today. I will also introduce Amber Raimondo. She is the Energy Program Director at the Grand Canyon Trust. She was born and raised in Wyoming, where she grew up off the grid in a wild landscape that taught her both the beauty and sacredness of natural spaces, and also an appreciation for how human demands for energy and everyday products take a serious toll on our environment and our health. Her family's land was explored for oil and gas by companies who didn't need permission. The remote. This inspired Amber to pursue environmental work in college, and she got her bachelor's degree from the University of Wyoming and her master's degree in environmental science and policy from NAU. Since graduating, she worked for the Wyoming Outdoor Council on energy and water-related issues in her home state before coming to the Grand Canyon Trust in 2016 to take on uranium mining on the Colorado Plateau. Last year, she testified twice before congressional committees on the threat of uranium mining to the Grand Canyon region. And lastly, Katie Huffing will be joining us towards the end of the presentation. And Katie is a certified nurse midwife and is the executive director of the Alliance of Nurses for Healthy Environments. Katie works with nurses and national nursing organizations on a variety of environmental health issues, including climate change, chemical policy, inclusion of environmental health into nursing education, and sustainable healthcare. Thank you so much to all of our presenters today, and we'll go ahead and get started with Dr. Roman. Thank you.
Thank you so much. It's a pleasure to be able to talk to you all about our environmental health research that we're doing on Navajo Nation in regards to metals exposure from abandoned uranium mines. As you probably know, there's over 500 abandoned uranium mines on Navajo Nation. This is a map of Navajo in the Four Corners area with the abandoned uranium mine sites in red dots showing the clusters of mining areas. In our research study, the Navajo Birth Cohort study, we enroll women when they're pregnant and follow them and their children to study the health effects. We enroll from all agencies. However, we currently have agreements and partners in place at Tuba City, Chinle, and Gallup Indian Medical Center. The Navajo Birth Cohort study's main goal is to assess pregnancy outcomes and child development in relation to uranium waste. We're currently in the third phase of our study. The first phase we started enrolling in 2013, and we enrolled pregnant women and their children, and this was funded by the CDC to follow children up through age 1. With additional funds from the National Institutes of Health, we were then able to follow their children up through age 5. And now we're currently in a third phase of the study called MBCS ECHO, where we've now joined the National Institutes of Health initiative called ECHO, which I'll talk about in a couple slides, to study the same effects we have been now with children up through age 8. This cohort is characterized robustly. We have surveys on demographics, cultural characteristics, exposures, and we also do extensive public outreach and communication of results. Some of you, if you've been in our partner hospitals, might have seen us at grand rounds or in the morning huddles when we try to talk to nurses. So this table just shows a bunch of the data collection events that we have. Our enrollment survey is fairly extensive, and we can get at demographics, education, household exposures. We also collect data on the proximity to uranium mines, people's past occupations, how they use the land, where they're getting water from, and we have used N2A records of what's in the water, as well as done some sampling of wells as well. Our home environmental assessment has a field staff member go into the home and actually do a gamma radiation. We post a radon canister and then collect that a week later. And our staff also takes dust wipes from several areas in the home where we can then get information on what metals are in the dust. Throughout the study, we take bio samples as well. When the parents enroll, we take blood and urine, and then we also get blood and urine from the children yearly. At least yearly, actually, we do more in the first year. And then our child developmental assessments include administering what's called the Ages and Stages questionnaire, where we ask about physical, behavioral, motor skills, problem solving, and communication. And as the children go through these, when we see concerns, if they're below a certain threshold, we ask if they'd like to be referred to Growing in Beauty, which is an early intervention program on Navajo. We also do an extensive developmental assessment at age 4 with clinicians. And what we're seeing is that a higher than expected number of children are presenting with either autism-like behaviors or speech delays. And we also take medical records reviews with our partnering hospitals, which get at health history as well. And this is done with a whole list here on the left of our Navajo field staff. So I mentioned we're in the third phase of our study now, which is now called MBCS ECHO. And what ECHO is, it's a National Institutes of Health initiative called Environmental Influences on Child Health Outcomes. And the goal of ECHO is to get over 50,000 children enrolled over the next couple of years. So what they've done is they've recruited researchers who already have birth cohorts, like we did with the Navajo birth cohort, and asked them to join this consortium where we're adding additional surveys and additional data collection. But we get to keep our main specific aims and still study uranium mines. But the goal of ECHO is to also study environmental exposures. However, they talk about it in more of a broad sense, not just physical and chemical, but on the right, they have their image here showing that their exposures that they're interested in also include societal, medical, psychosocial, behavioral, and biological exposures to see how that influences the development of children. And I'm sorry, this is an older slide. We now are following up with Navajo birth cohort study babies up through age 8. This just shows some of our enrollment numbers. So in the first phase of the study, we enrolled over 780 moms and babies, and we had a subset of dads enroll as well. We're no longer enrolling dads, but we hope to include them again in the future. And in our second phase, we had over 462 moms and babies. And now in our current phase, where data is being shared nationally, de-identified data is being shared with the consent of our participants, we have over 100 in the newest phase. And these are mostly moms that have continued with us through the years up. And we currently have 7-year-olds in our study, are the oldest. So going back to some of the data we've collected, this is data from our home environmental assessment, where field staff would go into the home and take some samples. And luckily, we see very low gamma radiation and indoor radon. We've had to make a handful of recommendations or referrals over to Navajo EPA because of this. Drinking water standards were exceeded in 13.3% of the homes. And this was from both regulated and unregulated water. So even some NTUA systems have exceeded drinking water standards for some metals. Next is the metals and dust that we get from those dust wipes. The next 2 bars are from the dust wipes. And we see in over 60% of the homes, there's metals found in this dust. And over 86% have detectable uranium in their house dust. Now, we can't really say what this has as a health effect, but there is no known benefit to humans of uranium. So this is just showing some of these exposures that we were talking about. So I know this presentation is, this webinar is mostly about water, but dust is actually another major way that we think uranium is getting into the bodies of people. So again, this is just showing the uranium in those dust wipes, that it's more or less evenly distributed throughout Navajo Nation. This is not just for people who live right next to the uranium mines. And if, most of the attendees on this webinar are from the area, they'll know how dusty and dry this area is. So it's probably not very surprising to think about that uranium that's left over from these legacy mines might be blowing through the wind. What's also interesting is that we have some researchers at UNM looking at the metal particles in this dust on a very fine level. And what they find is that these are actually, uranium is in respirable fractions, so they can actually get inhaled and cause effects in the lungs. And if they're small enough, this also gets into the bloodstream. So we think this is one route of exposure for participants, because we do see an increase in uranium in urine in participants. So this graph shows the uranium in adult participants. On the top left is our graph of uranium. There's 2 peaks there. There's a light brown superimposed on a dark brown graph. The light brown is for females and dark brown is males. And what we found is that This is also a little bit of an old slide. Our numbers are a little higher now, that about a third of our adult participants have urine uranium that's greater than the 95th percentile of NHANES. And NHANES is basically the national average. So if you took a random sample, you should have about 5% of people at this level. What we see on Navajo is over a third have this level. The black bar in the graph shows the 50th percentile for the US population. So you can see that the peaks are actually shifted to the right, showing a higher uranium exposure. What I don't have on this graph is our findings from children. So at birth, we see low but still present levels of uranium, which are consistent with the fact that uranium can cross the placenta. And also, as the kids age, we're seeing increases in uranium, where 1-year-olds almost look like the adults, and we see this increasing through age 5. So there's both a in utero and then environmental exposure that we're seeing as evidence. Uranium is known to cause kidney toxicity, and it can be an estrogen mimicker, and it can also affect your DNA, which I'll talk a little bit about next. In arsenic, we have a little bit different picture here, where the peaks for our population match up with the 50th percentile of the national average. However, even though it looks like there's similar exposure to the US population, in most of the US population, arsenic comes from primarily dietary arsenic, primarily in seafood and rice, which is a different form of arsenic, which then we're seeing in most of our participants. So the form that this Navajo population might be exposed to could be more toxic. So even though the average is lined up, that doesn't mean it's not a problem. So we have an artist in residence that actually helps us with our community outreach and helps us to depict in art some of these complex scientific concepts that we try to get across. So on the left, you can see DNA damage through radiation, and on the right is DNA repair with beads on a string repairing themselves. So every day we have insults to our DNA. Even, the sun is radiation that can break DNA, and usually we're pretty good at repairing ourselves in a healthy body. However, if you have arsenic or uranium in the body, this can actually inhibit the repair process. And what we know from unrepaired DNA, this causes damaged cells, which can lead to cancer, immune system diseases, and neurologic disorders. And some of our researchers have even published on this and are looking at this in the lab as well. But mostly I brought this up to bring us to another study that we have that's not part of the Navajo birth cohort study. It's actually part of our Metals Superfund Research Center, which is largely an environmental project, but we do have biologists on the Metals Superfund research as well. And what they're doing is a clinical trial called Thinking Zinc, where they give participants dietary supplements of zinc and look at different measures of DNA repair and immune issues. So the long-term goal of Thinking Zinc is to determine whether dietary zinc supplementation reduces metal-induced human disease, and the project goal is to conduct this clinical trial of dietary zinc supplementation to assess effects of biomarkers of metal-induced toxicity. So what they're doing is they're taking blood and urine from participants before asking them to take a dietary amount of zinc, and that's very important because too much zinc can be a problem. So this is a very small amount of zinc. And then after 9 months, they take urine and blood again to look at biomarkers that could be involved in immune disorders, or they're also going to look at DNA damage and DNA protein repair protein activity that we talked about before. So again, there's another artwork from Mallory Kotaki, our artist in residence, showing a cell here. It's an immune cell being protected with tribal motifs. Another artwork here by Mallory was recently on the cover of Maternal and Child Nutrition, called Placental Transfer. And this was to go along with an article that was published mostly on dietary research that we found. So another finding of our study is that this population is low in zinc, which led to the zinc supplementation study. And also iodine is a very, very important dietary issue that we found that is low. So our recent publications include findings on metals levels, including what I mentioned, high uranium found in biosamples from Navajo participants. We're now just beginning to see data come in from some of these older kids, age 5 and above. But through age 5, we do see that even in kids, uranium is increasing, uranium levels in the urine. We've also published data on diet and nutrition in pregnant women. I mentioned a couple of the main findings there. Another main finding was that, as a whole, pregnant women on Navajo have really similar diets to the national average when you take in, caloric, fat, sugar. But what they found was that the sugar is largely coming from drinks. So that could be an important intervention for pregnant women to talk about sugary drink consumption. We've also published on neurodevelopmental assays on children up through age 1 year of age, but now we are assessing up through age 8, and markers of immunity associated with proximity to mines and metals exposure. In addition, our stats team works on new ways to model and analyze the health effects of exposure to multiple metals. So it doesn't seem to be just uranium, but uranium with these other metals that are also in these legacy mines, and having people be exposed to these are also important. So I just have some of these publications referenced here. And I just also want to acknowledge all of our teammates that make this research possible. We also work with SRIC, the Southwest Research and Information Center in Albuquerque, the Navajo Department of Health. Some of our data collectors are actually cheers, and UCSF for their expertise on neurodevelopment. And with that, I'm done and can take any questions, or are we holding questions till the end? Sorry.
I think we're holding the questions until the end. Thank you, Dr.
Thank you so much.
Amber, if you want to take over.
All right. Hi, everyone. My name is Amber Rimondo, and I direct the energy program for a nonprofit here in Flagstaff called the Grand Canyon Trust. And today I'm going to talk to you about uranium mining in the Grand Canyon region and the fight to permanently protect it from, to protect this place from any future uranium mining, and to stop the spread of the toxic legacy that is really related to a lot of what you just heard Carolyn talk about. So really quickly, if you're not familiar with who we are, the Grand Canyon Trust is a regional nonprofit. We're based in Flagstaff. Our mission area is the entire Colorado Plateau, which is a lot of Utah, western Colorado, northwestern New Mexico, and northern Arizona. And our mission is to safeguard the wonders of the Grand Canyon and the Colorado Plateau while supporting the rights of its native peoples. There's a lot of detail that I could get into today, but with the amount of time that we have, I'm going to try my best to skim over the basics and not leave too many gaps. But I'll start out with just a little bit of a uranium 101 for anybody who might want or need that, to talk about what exactly uranium is, what it's used for, how it's mined, and then what's really at risk, in particular with it being mined near the Grand Canyon, and what's being done to stop that, and how the nursing community can help. So uranium is a radioactive heavy metal that is really common in the Earth's crust. What's less common is its presence in concentrated enough deposits that mining companies actually want to pursue it. There are many isotopes of uranium, but the least radioactive isotope is uranium-238, and that has a half-life of 4.5 billion years. So once we remove uranium from its relatively stable place beneath the Earth's surface, that's how long we have to actually manage the uranium and keep it out of our human environment. So 4.5 billion years, that's longer than any of us can probably fathom, and maybe even longer than the human race has left on the Earth. I'm not really sure. But and really quickly too, I think when I talk about what I mean by stable deposits of uranium versus unstable once it's mined, has a lot to do with the fact that uranium is mobile in water when oxygen is present. So a lot of the deposits, a lot of the concentrated deposits of uranium that miners are targeting formed in the first place because oxygen was no longer available. And so it came out of solution where it may have been traveling in trace amounts in groundwater and started forming this more concentrated deposit. But once we mine it, we reintroduce oxygen to the equation, and then the uranium wants to hitch a ride with flowing groundwater or air and dust particles, et cetera, into the human environment. So that's the primary concern. So when you hear folks making really incorrect arguments about how uranium mining is somehow good for the Grand Canyon because you're removing the uranium threat, that is not true. You're just creating a legacy problem. So the image that you see in front of you, the upper left-hand corner, is just an example stock footage of what a piece of uranium ore looks like. That's what's pulled out of the ground. It's mostly rock. It's a little bit of uranium oxide. Then that uranium ore has to be hauled off to a mill. And for us in the United States, that mill is in southeastern Utah. It's called the White Mesa Uranium Mill. And that's where they process the ore, they crush it, they run it through an acidic milling process, they dry it, and then you get this yellow powder in the upper right-hand corner called yellow cake, which then has to be further processed in order to be used in things like nuclear fuel rods at nuclear power plants, and enriched even further than that to be used in something like a nuclear bomb. So there are a few different types of mining methods, and I'm only going to talk about one today, given the time, but just so you know, there are three main types. There's in situ recovery, that's where wells are drilled and an oxygenated solution is pumped down to take up the uranium, it's brought back to the surface and they extract it. There's open pit uranium mining, which is exactly what it sounds like. It's removing the surface and creating this big open pit. But what we're going to talk about today is underground uranium mining, because that's the kind of mining that is used in the Grand Canyon region. So this image that you see here is a characterization of a typical uranium deposit and uranium mine near the Grand Canyon. So at the very bottom of the graphic there, you see the Redwall Moab Aquifer. That's in the Redwall limestone. That's about 2,000 feet below the surface. And millions of years ago, these caverns that were in the limestone collapsed. And over time, layers of rock on top of that collapsed until you get this vertical collapse feature of crushed rock. And we talked about how uranium is very ubiquitous in the Earth's crust and in small amounts. And over those thousands or millions of years, water was carried that uranium down through the crushed rock feature of the breccia pipe. And when it reached a place where oxygen was no longer available, it came out of solution and started forming these concentrated sources of ore. And just for your reference too, so I mentioned that the breccia pipe is about 2,000 feet deep. They're typically about 300 feet wide. So when you're looking at a uranium mine like this on the surface, it doesn't actually look like a big operation. Like a typical mine site near the Grand Canyon might be 20 acres on the surface. But what the main concern comes from what you can't see, which is the mixing of water and oxygen and newly exposed uranium ore. So when they mine it underground, they drill a mine shaft down next to the breccia pipe. You can see it here in this characterization. It's usually about 1,000 to 2,000 feet deep. And then they drill horizontal deposits into the ore deposit to haul the ore out back into the main mine shaft, haul it up to the surface where it's stored on site until it can be trucked to the White Mesa mill. So why do we care so much if uranium mining happens near the Grand Canyon? Well, if the kind of legacy that Carolyn just talked about isn't enough, the Grand Canyon region is really unique in a lot of ways, but in particular with uranium mining, the geology is highly fractured. And so makes it really difficult to say exactly where, if groundwater is contaminated, where it's going, how fast it's going to get there, and what exactly is at stake if a uranium mine is to be approved. So I guess the easier way to describe the hydrogeology, the groundwater flow, direction, and speed in the Grand Canyon is to think of it more like a system of pipes that was designed by Dr. Seuss. So water in one point can go into a bunch of different directions at once. And in one direction, it might take weeks or hours or days to get to a seep or a spring or another aquifer. And in another direction, it might take decades or hundreds or thousands of years to move. So there's just a lot of unknowns with regard to the geology in the Grand Canyon region. And places like what you see here in this image are at stake when we allow uranium mining without having that understanding of where contamination might be able to move. So maybe some of you have been down to Supai Village. Maybe you've seen Havasu Falls. This turquoise blue water is not photoshopping, that's real. And this creek, Havasu Creek, flows from the Redwall Moab Aquifer. So if we look back at that graphic, the Redwall Moab Aquifer is a regional aquifer. It's a very important source of water for Havasu Creek, for Grand Canyon National Park, for the town of Tucson, and not just the Redwall, but other aquifers in the region as well are only going to become more and more important as we move into the future with climate change and knowing that the Southwest is going to get hotter and drier, most likely. So Havasu Creek is not just important because it's beautiful, it's important because the Havasupai tribe resides in Supai Village, which is really remote. It's the only way to get to it is by an 8-mile hike, an 8-mile mule ride, excuse me, or a helicopter ride. So this is their only source of water. It's something that they're spiritually connected to. Havasupai, Havasu Baja actually means people of the blue-green water. So if the Redwall Moab Aquifer were contaminated by uranium mining, this would be absolutely devastating for the Havasupai tribe, not to mention any other communities that use water in this region and the seeps and springs inside the Grand Canyon that support really delicate ecosystems. And we don't have a ton of time, but I'd be remiss if I didn't just give you kind of a bigger picture here of the impact of Grand Canyon area uranium mining and kind of the region that Carolyn was talking about. So in the upper left-hand corner is a photo of Canyon Mine. It is a permitted, developed uranium mine on the south rim of Grand Canyon or near the south rim of Grand Canyon. It's not currently mining. I'll talk about that in a minute. But when ore is hauled from Canyon Mine or any other uranium mine in the region, it has to be trucked to the White Mesa uranium mill. And I put an image up there of the haul route for Canyon Mine. And that haul route goes across the Navajo Nation, which banned uranium mining, milling, and transport in 2005 because of the toxic legacy that is left on Navajo Nation from past uranium mining. But because these are ADOT and UDOT highways, these companies take the ore across anyway. And it goes to the White Mesa Mill, which is it's owned by the same company that owns Canyon Mine. It's called Energy Fuels Resources. The mill, the picture that you see at the bottom there is the mill. It has confirmed shallow groundwater contamination beneath it. The company denies having it had anything to do with it. And the mill sits just about 3 miles north and up gradient of the Ute Mountain Ute community of White Mesa. And this community has been adamantly opposed to the mill for years. They're concerned about their groundwater today and also the groundwater of their drinking water in the future, because this mill, even when it closes down, is going nowhere. The waste that is in those 40 to 80 acre each impoundments is going to be there in perpetuity. It'll be capped, but again, what kind of human engineering can actually do its job perfectly for the rest of human existence? That's a really tall order. So back to the Grand Canyon. I put this up here so that you can see the kind of risk that we're looking at. So this is the kind of interest that there has been in mining uranium around the Grand Canyon. Every orange dot you see on this map represents a mining claim that existed in 2008. So on this map, there are over 8,200 mining claims filed on public lands, that's BLM and Forest Service lands, north and south of the Grand Canyon. Each of these dots isn't necessarily a permitted, and actually most of these dots is not a permitted or developed mine, it's just a claim. It's a private individual or company coming in and saying they have a right to mine there. Canyon Mine is in this lower, there are 3 parcels here of what we'll talk about in a second, a temporary mining ban. And in the southern parcel, you'll see Canyon Mine, and that's the only mine that is currently at least allowed to operate despite a temporary mining ban that we'll talk about more in just a second. So because of that kind of interest, because so many uranium mining claims were staked by 2008 that were resulting from a brief spike in the price of uranium, a lot of people in northern Arizona got really concerned. And it wasn't just groups like mine that are environmentalists, and like people might say, like, of course you care, you're an environmentalist. But we're talking local governments, cities, counties, tribal governments, the Navajo Nation especially, and the Havasupai tribe especially, the sportsmen's groups, businesses. It was a broad community that all came together to say the risk to the Grand Canyon is not worth allowing uranium mining to happen. And so after a long public process where there was an environmental assessment, an economic assessment, the administration at the time decided to impose a temporary mining ban. So administrative mining bans can only last up to 20 years. If we want a permanent mining ban, that has to come via an act of Congress. And I just put this up here to show you, again, this is the current status of mining claims in the area. This is claims as of 2018. So each of those mining claims that you saw in 2018, they have to be maintained on an annual basis. Otherwise, they expire. So I guess this is just important for you to know, because you can see how claims are dwindling, and it just speaks to the importance of continuity. So we need this temporary mining ban to stay in place, and we need a permanent mining ban without any gap, so that other mining claims can't come in and be staked in any sort of intermediate, because then they have a chance to be given an exception like Canyon Mine was given. Oh, does anybody else have a blank? Oh, here we go. So the concern right now is that the temporary mining ban, because it is administrative, is tenuous, that an administration who doesn't want it to be there could try to lift it prematurely before 2032. So we've been trying with the same broad coalition of supporters to get a permanent mining ban. And meanwhile, over the last 4 years, there has been effort after effort to undermine protections for our public lands that include the Grand Canyon against uranium mining. And again, that's another thing. I could go down a long list of things that have happened, but I'll just highlight that for the first time ever, in 2017, the uranium was listed as a critical mineral. And what that does basically is to allow for a justification for shortcutting environmental and public health protections against that we have to protect us from uranium mining. And that's been a serious problem that has continued to make other issues kind of stand on its shoulders. So happy to talk about more of that offline if anybody wants. So Canyon Mine, like I said, it is the only permitted mine to operate within the current withdrawal area. It is what we call a modern mine, which just means that it was developed after the creation of environmental laws. So it was permitted in 1986, and it still has never actually mined ore. That's another issue. But what they have done is fully develop the mine. And really, Canyon Mine is a poster child for the kind of risk that we say stems from the uncertainties of hydrogeology in the Grand Canyon region, because when the mine was first being permitted, the company promised that it was not going to hit water in the mine shaft, which, of course, as we've talked about, introduces a significant risk. They said the groundwater only existed well below the mine. Well, lo and behold, in 2016, as they're digging their 1,400-foot mine shaft, they hit significant water, and that water begins to be contaminated with elevated levels of uranium and arsenic. And to date, over 30 million gallons of water and counting have flowed into that mine shaft. And of course, we're not worried that somebody's going to walk onto the mine site and drink out of the wastewater pond. What we are worried about is either that the company loses control of that water, that it's seeping through the sides of the mine shaft, or the more likely situation is that once the mining company is gone and they've walked away and they've plugged the groundwater flow, no man-made plug is going to protect that place in perpetuity. Every man-made plug will fail eventually. And so someday when nobody is looking at that anymore, nobody's paying attention, this could come back and cause serious problems in the future. So the Grand Canyon Centennial Protection Act was introduced and passed last year in the House, in the US House. It had some Republican votes and most Democratic votes. It was introduced in the Senate last December, and that's where it sits today. It has yet to get a committee hearing and markup and vote on the Senate floor. But in July, the National Defense Authorization Act on the House side took the Grand Canyon Centennial Protection Act on as an amendment. And so now we're waiting to see what happens in conference committee. But if this is able to go through, it will make the temporary mining ban that is in place right now permanent. So what can you all do? You can help us broaden support for the permanent mining ban. People need to hear from more than just someone like me who works for an environmental group. You can engage in direct or grassroots lobbying, whether you do it as in your capacity as a nurse or as a private citizen. You can write open letters to decision makers, write op-eds or letters to the editor, and you can help to educate the public about the risks of uranium mining, and maybe from your perspective as a health professional. And that's it. There's a lot that you could tell I was probably trying to hurry through, but I'm more than happy to answer any questions either now or offline. We have a lot of resources on our website that I'm happy to point you to help fill in some of the gaps that I might have left today. And that's it.
Thank you so much, Amber. Great, Katie.
Thanks so much. And thank you to our previous two speakers. That was really great. And for me, it just makes me more determined to be using my nursing voice to be working for clean water. So I just have a couple of slides here before we open it up for questions. The Alliance of Nurses for Healthy Environments has been working on a variety of water issues for a number of years. And over the past few years, there's been a number of regulatory rollbacks. There's been some different budget issues. And so I just wanted to highlight a few of those for all of you, just to see the many opportunities that are available for nurses to really be highlighting why it's so important for us to have clean water and ways that we can do it. Just as thinking about how much water we use in healthcare, how many times a day we wash our hands, we give babies their first bath in these waters in our healthcare institutions. And just, in healthcare, we recognize how vital water is to be able to do our jobs properly. And so making sure the places that we live have access to that clean water is really important. So first I wanted to talk about budget cuts. President Trump has repeatedly put our families at risk by proposing significant budget cuts in his yearly budget that he puts out. Trump's 2021 budget proposal proposes that the EPA's budget be cut by 27%. It would also take $780 million from the Clean Water and Drinking Water State Revolving Funds, which are the largest source of federal funding for water infrastructure. This is especially important in communities that have older infrastructure, such as in communities like Flint and other cities where we've got older lead service lines. Being able to replace those using those funds is really important. And unfortunately, the EPA is already underfunded, and so getting a 27% budget cut can really impede their ability to tackle their mission, which is to protect public health and the environment. Another emerging area of concern is around a class of chemicals called PFAS. There's about 1,000 different chemicals in this class, and they're used in a variety of different products, everything from food wrapper liners to stain repellents, water repellents. It's used in different industries. And unfortunately, over the past few years, we've started to recognize that in many communities around the country, there's significant groundwater and drinking water hazards related to PFAS. And the Trump administration has opposed legislation to clean up these PFAS chemicals that have gotten into our water supply. And there's currently some legislation that would have provided $550 million for cleaning up PFAS pollution that's occurring in places such as Tucson, where they have found PFAS contamination is above the EPA's health advisory level. Unfortunately, just like with many other environmental exposures, communities of color are disproportionately impacted by PFAS contamination in their water supply. So again, I think it's something that really speaks to nurses and getting our voice out there in support of pieces of legislation that could address some of these disparities. And this was something that our organization has been working on for a number of years. It's the rollback of the Clean Water Rule. And the Clean Water Rule added onto the Clean Water Act to really say which streams, which bodies of water are really necessary to be protected to protect our drinking water supply. And after years of hearings and thousands of pages of testimony under the Obama administration, they finalized the Clean Water Rule, which would protect drinking water for 1 in 3 Americans. Under the Trump administration, they've rolled that rule back. They've repealed it. And this is especially troublesome in states like Arizona, where there's no similar state level regulations to fall back on. And so that means for more than 90% of Arizona's streams and lakes that they're now completely unregulated and unprotected. And this puts them at greater risk of pollution and destruction from development such as oil and gas production and other industrial activities. Nearly half of all Arizonans, which 48%, get their drinking water from streams that were covered under the Clean Water Rule and are now unprotected. So, as we're looking at access to clean drinking water, issues around climate change where we're having more droughts and really need to protect these clean water sources, not having these protections, I think, really destabilizes our clean water sources. And finally, I just want to put a plug in. If you're listening to these presentations tonight and you're like, what can I do right now? We are organizing really quick selfie videos. We've got lots of information on how to do it. We can help you kind of write a script. They're super simple to do and they can make a really big difference. We've done several of these video series with nurses around the country, and they're so inspiring and really help other nurses want to be engaged in this type of activity. Talking with local policymakers, talking with their colleagues about environmental protections and how it impacts health. And so Kara will be sending out information to all of you attending today on how you can engage in this. And I hope one or two of you would like to do that. It's a really great way to, like I said, to get that nursing perspective out there. And we'd love to have you join us. Also, all of you here today, as new opportunities arise to be engaged in advocacy around things like uranium mining in Grand Canyon, we'll definitely be in touch because as the most trusted profession, when you put your nursing voice out there, policymakers really listen, and it's pretty amazing.
Thank you so much, Katie, for your presentation. We're going to go ahead and to all the presenters, Amber and Dr. Roman, we're going to go ahead and get started with a Q&A for the rest of the time that we have. And thank you so much, Perla, you're saying that that was a wonderful presentation, she says. So I do have a question myself, and then I'll open it up to everybody who wants to ask a question. So what does outreach to these communities look like? And what are the alternatives available, for those that are affected?
Hi, this is Carolyn from the Navajo Birth Cohort Study. So the outreach that we do is at all levels. We've done, presentations like these, and we also have our field staff who live on Navajo Nation going to chapter houses and doing smaller level presentations like that, just to let people know what we're doing, what some of our findings are. And then, of course, there's outreach and research translation at the publication level as well. I don't know if anybody else wants to take the rest of the question.
Thank you. Looks like we do have a question. Dolores asks, which is the best route to test for uranium in the body?
Well, there are multiple ways, but the easiest collection and easiest assay is really through urine. However, there is the consideration that this is a snapshot in time as your body, repletes and remakes this. So you can actually get, interestingly, what we're going to be starting to do soon in our study is actually asking for shed baby teeth and hair, because this is a really long timeline of exposure. Just as your hair grows, you can tell if you have really long hair, you can tell what era in time you were exposed to something. And also teeth can deposit metals, and teeth grow just like a tree trunk does with rings. So the more inner rings are your earlier lifetime, and then it builds on that. So there are multiple ways to actually do that, but currently urine is the best way that we're doing it.
Thank you. Any other questions? Okay, it looks like Elisa wants to know, what can nurses do? Oh, if they can, nurses, the slide can be placed back up. Perfect. Any other questions from the attendees?
I would also just like to add that just talking about it with your community members, with your family, with anybody informally can help a lot too. I'm not from this area, and most of my life I didn't know any of this was going on. And we run into people all the time that even do live in this area that don't have a lot of knowledge. So just spreading the word even informally, I think helps a lot.
I do have another question for Dr. Roman. Are you seeing any immediate health effects from uranium exposure in the Navajo cohort birth study?
It takes a lot to actually see immediate health effects. So what we're more concerned is with these ongoing environmental legacy exposures. So before the Navajo birth cohort study, there was actually what's called the Dene Project, and this was a study of older adults. And what they found was that people were actually involved in the active mining area, either were miners themselves or family members of miners, so they lived close by the mine when it was active, or especially one that we hear all the time is women washing the clothes that came home with the uranium dust on it. Those people had a more serious interaction, a more severe interaction with uranium, and in that cohort, they actually found that there was increased risk of kidney disease and multiple chronic diseases like autoimmune diseases and hypertension that could be caused by uranium. A lot of the people who would be in that study as minors were actually deceased from lung cancer and respiratory diseases as a result from their occupational exposures working in the mines. But those people, as I mentioned, the family members that, these miners came home with uranium on them, they did actually see an increase in these chronic diseases. But again, it does take a longer chronic exposure to really see this. And what we're dealing with now is ongoing legacy exposures. These are, the grandchildren and great-grandchildren of the miners. And what really seems to be important is how people are using the land, how their proximity to waste. We have stories of people who live near the waste piles and actually played on them, not knowing what they were. All these things do make for increased exposure that we're seeing over time really makes a difference now. So there's not so much an immediate effect because I think, as some of the presentations spoke to, you're not in contact with the ore directly or the yellow cake. So it does take a little bit longer, but it's still a serious problem.
Thank you. We do have a couple more minutes. Are there any resources, websites that we can utilize to keep up to date on these findings?
We have some websites through UNM, but we are working on a new one of that, so I can send that out when we get it. But if you just search for Navajo birth cohort study through a UNM, we have some of our findings.
Great. And Annabelle wants to know, what types of policy initiatives are being undertaken to protect Navajo communities and mitigate the impact?
This is Amber. If Carolyn doesn't have, I'll give Carolyn the chance first to say something.
The only one I was going to mention was, I think it's the post 86 group. Most recently, there's a group where miners who were after a certain year were not getting benefits, and they're working to get those. Other than that, I didn't have much of an answer for that right now.
Yeah, and this is Amber. I don't really have much of an answer either in terms of policies that are being pushed to help with the health impacts. I know there have been some budget pushes in Congress to at least to help with the cleanup of those 500 mines that still litter Navajo Nation. But yeah, it's. I mean, I think the part of the problem is that it is a huge legacy, and there isn't like a close light at the end of the tunnel in terms of reducing or eliminating these folks' exposure.
Thank you. We have run out of time, but I do want to thank everyone, all the presenters, for giving us this very important information. And I'd like to turn it over to Kara to let us know about the continuing education information and close us out.
Yes, thank you so much, Paulette, and thank you to our 3 fabulous speakers. Just a reminder, you can receive 1 continuing education for this webinar, and you will receive an email tomorrow with the evaluation and the post-test that you'll need to complete to get your certificate. So thank you so much for joining us, and thank you to Phoenix Chapter of NAN for hosting this webinar with us. Thank you so much.
Thank you.